Hey Revivers, Dr. Nguyen here, back again for another video continuing our series on an introduction to weightlifting. If you haven't checked out our first video of this series, click on the link in the description section below to check it out. While you're at it, be sure to like our video and subscribe to our channel. If you found this video helpful in any way, please feel free to donate. We greatly appreciate it. So let's begin. Today, we will be discussing how to properly perform a squat based on your personal body mechanics and posturing. Everyone's squat is going to look a little different depending on your current postural adaptations and personal biomechanics. Building off our last video, it's important to understand how to position your body properly in standing, joint by joint, starting at the feet all the way up to the head. I will be using the same conceptual format in this video to expand upon the last and give a clear joint by joint position for your squat. Okay, we're going to start at the feet. You want to begin with your feet about shoulder width apart, keeping all 10 toes planted into the ground with pressure in your heel. The amount of ankle eversion of your foot will vary depending on how much ankle mobility you have. A common misconception is that your foot has to be straight. A normal foot range of motion for eversion is between 7 and 15 degrees, so play with it and see what best works for you. At the knee joint, you're going to make sure that your knees flex forward over the plane of your toes between the first and second digit. You don't want them to come in and have nothing to go over. You want them to be over your toes and ideally come right between the first and second digit. You'll also want to make sure that your knees don't come too far forward in this plane past your toes. You can achieve this by using that hip hinge technique that we learned earlier, bending at the hip, and you can see that that draws my knees back so that they are just slightly over my toes. A nice check is to kind of put your hands down and you'll see as your hand blocks your knees how far they go over your toes. You don't want them to go this far over your toes because you'll put too much pressure on that kneecap and knee area. The amount your body is going to be able to hip hinge is going to vary greatly depending on your low back and hip restrictions. As long as you maintain that neutral spine and engage your core to bend at the hip rather than rounding at the spine, you should be good to go. The next joint up is going to be the rib cage, the shoulders, and your head position. This is going to vary depending on what type of squat you are performing and whether or not you're doing a body weight squat, a front squat with a barbell or a weight, or a back squat. In general, for the upper portion of your body, you're going to want to maintain an open chest, a neutral cervical spine with the center of your mass going directly from your head through to your feet. So I'm going to demonstrate for you guys based on my personal body posturing what it looks like. So my feet are going to be slightly everted because I have a history of some ankle sprains. My knees are still going to be over those toes as I come down. I'm going to hinge a certain amount at the hip. So you'll basically see based on my body mechanics what it's going to look like. We're going to do an air squat here. So I like to put my hands together as I come down. Knees go over toes but not too far in the frontal plane. You can see that I'm hip hinging with that neutral spine. My chest is up and my head is forward. I actually don't like looking too straight ahead just because of that neck extension. So what that looks like in real time is here. Okay. For the side view, again, ankle eversion, knees over, hip hinge, chest up. We're just going to come down. Okay, so for those looking to do a frontal squat without using a barbell because it gets a little complicated, I like just taking a weight, holding it like this, keeping it close to my chest, and then you're just going to perform that frontal squat. Okay, front squats are good to engage the quads more quad dominant because the weight is in front. And so there you go. A variation of that frontal squat with the weight will be with a kettlebell. Just maybe gives people a little bit of an easier handle. Again, close to the chest, weight forward, so it's going to be more quad dominant. So a front squat with a barbell is going to be a little bit more of an advanced technique. So I'm not going to demonstrate it particularly in this video, but I will show you how to do a back squat. This basically is going to resemble a barbell. You'll want to have a squat rack, and basically it'll be here. You're going to step in front of it, put it on your traps, come in, rest it here, and then basically do the same motions For this one, your hip hinge is going to be vitally important because of the way that the weight is going to come down on your shoulders. So you really need to make sure that you engage that core and keep that spine in neutral. Okay. And there you have it. Hopefully we've gained a better, more thorough and comprehensive understanding of proper squatting mechanics. Let me know what you think in the comments section below. I'm Dr. Preston Nguyen, Certified Strength and Conditioning Specialist. At Rehab and Revive, we heal smarter, not harder.